Hi, everyone, and welcome. Today, we're going to talk about something that sounds a little scary: complications during labor and birth. Now, don't panic. This isn't a horror story session. Think of it more like a pre flight safety briefing for birth. We hope you never have to use everything we talk about, but it's super helpful to know what's available, how we respond, and what to expect if something unexpected happens. Our goal today is to give you the confidence that whatever comes up during labor, you're not alone. We'll go over potential complications, what signs to watch for, how the care team reacts, and most importantly, how you can stay informed and involved in your birth experience. By the end of this session, you should feel prepared, empowered, and ready to ask questions that come to mind, because chances are you're going to think of some, and now's the time to ask them. Okay, first up, meconium. Sounds fancy, but it's really just your baby's first poop. Technically, while still in the womb. Babies sometimes pass this into the amniotic fluid during labor. Why does this happen? Well, sometimes it's just because the baby's been baking a little too long. Think postterm, around 41 to 42 weeks. Other times, it can happen if your little one is feeling a bit stressed during labor. Now, before anyone gets squeamish, remember this: meconium isn't automatically dangerous, but it does alert us that we need to pay close attention and take a few extra precautions to keep baby safe. Your care team is totally prepared for this. Depending on the situation, once the baby is born, we may need to clear the airway right away to prevent any breathing issues. This is usually quick and done right at the bedside. If your plan is a water birth, here's an important note. If birth is imminent and meconium is present, we may ask you to get out of the tub. Why? Well, a stressed baby might need extra help transitioning from the uterus to the outside world, and giving that support is very challenging if you're still in the tub. It helps the team act quickly and effectively. Seeing meconium can feel scary, but it's fairly common, especially if your baby is a little overdue. And the best part? Your team has been trained for this exact scenario, so you're in good hands. Most of the time, babies are pretty low maintenance. All they need is a little wiping of the face, clearing out of the mouth, and a gentle drying, basically like a tiny spa treatment to get them ready for the world. Sometimes, though, a baby isn't quite ready to take that first big breath on their own. In those cases, we help them along with a special bag and mask. Think of it as giving them a gentle nudge to remember how to breathe. Rarely, a baby might need a few more breaths to fully switch from fetal circulation to newborn circulation. And if things are really tricky, we don't hesitate to call in extra support: paramedics, EMTs, or even a life flight team. Safety is always our top priority, and we have a whole squad ready to jump in if needed. Sometimes babies just need a little extra motivation to make their grand entrance. Occasionally, they have a hard time getting out of the pelvis. Big babies, small babies, even stubborn babies who think the pelvis is their personal VIP lounge. If the shoulders get stuck, we'll ask you to try different positions: hands and knees, sliding to your side, or squatting to help those shoulders wiggle free. If you're in the tub, we'll ask you to get out and onto the bed. Water birth is great, but sometimes gravity needs a little more help. And yes, there may be two of us helping lift your legs high, knees to your ears, basically a temporary yoga pose, because it actually makes more room for the baby to move. In some cases, helping the baby out requires a bit more hands-on teamwork, literally. The delivering provider might need to put their hands inside the vagina to help rotate the baby, guiding them out safely. Rarely, we might need to make a small cut. Yes, that's the infamous episiotomy, to give the baby a little extra room. Sometimes the baby's clavicle might break. Don't panic, babies heal remarkably fast, and this usually doesn't cause long-term issues. And occasionally, the baby might experience a temporary palsy, where the stuck arm has decreased movement for a short time. Again, most of the time, full function returns as the baby heals. Preeclampsia is basically when blood pressure decides to throw a little extra drama into pregnancy. If your blood pressure rises to 140/90 or higher, and you have other signs of preeclampsia, it's a signal that we need to step up your care. At our birth center, we're limited in what we can safely manage for preeclampsia. So, if delivery isn't imminent, the safest option is to transfer you to a facility that can provide the monitoring and support that you need. Why is a higher level of care necessary for preeclampsia? Well, elevated blood pressure during pregnancy isn't just numbers on a chart. It can lead to serious complications, including seizures. Being in a hospital setting allows for medications that help lower the risk of seizures, and it also ensures that both you and your baby are closely monitored. This way, your care is coordinated for the safest possible outcome for everyone involved. After the placenta is delivered, some bleeding is completely normal. Your body is doing its job and cleaning house. But too much bleeding can cause problems, so we keep a close eye on it. This is all happening during the third stage of labor, which is just a fancy way of saying the delivery of the placenta. Active management means we're paying attention to the cord, watching for signs that the placenta is ready to be birthed. It's kind of like being a very attentive conductor, making sure the finale goes smoothly and safely. Sometimes bleeding doesn't stop right away, and we need to help the uterus do its job. One simple step to the making sure the bladder is empty. A full bladder can get in the way of the uterus contracting. If needed, we use a small catheter to empty the bladder, and then it's removed immediately. The next step is medication. Pitocin is a medicine that helps the uterus clamp down and reduce bleeding. It's usually the first medicine we use and is given as a quick injection in the thigh, like a tiny nudge, to help your body finish up that final stage safely. If bleeding continues despite the initial measures, there are additional medications we can use. These include misoprostol, which is placed into the rectum, as well as Methergin and TXA, each helping the uterus contract and slow the bleeding. If multiple medications aren't enough, we call in EMTs, start IV fluids in your arms, and provide more advanced support. One very effective tool is a balloon catheter, which is placed through the cervix, inflated, and connected to suction. This helps decrease bleeding quickly and gives your body a chance to stabilize. Labor and birth are incredible, natural processes, but sometimes things don't go exactly as planned. Complications like breathing difficulties, shoulder dystocia, high blood pressure, and bleeding can happen. And that's why we have trained teams, protocols, and safety measures in place. The good news is that most of the time, babies and birthing people do just fine. And when extra support is needed, we're ready to step in quickly. Our goal is always the same, to keep both you and your baby safe while supporting a positive, empowering birth experience. Thanks for listening today, and remember, we're here to answer any questions and guide you every step of the way.